Hello, I'm Dr. Craig Escude, president of IntellectAbility, formerly known as Health Risk Screening. Welcome to Medical Monday. Today on Medical Monday, we're going to talk about another document that can be very, very helpful for people with intellectual and developmental disabilities. It's something that we call a health passport. So we know that it's important when a person goes to a doctor's visit or to a hospital to provide basic medical information. Things like, who are the person's different healthcare providers? Who's their family contact? Who's their emergency contact? What are their main medical diagnoses? What are their medications, their allergies? All of those different types of things. So those types of things, are really important for healthcare providers to be able to have access to. But there's some additional information that's particularly important for people with intellectual and developmental disabilities, especially if they don't communicate very well using words, if they aren't able to express themselves verbally and interact with other people in ways that other people will understand who they are, what they like, what they don't like, what are their usual reactions to things. So this health passport document has a lot of this information on there. It's something that a person who knows that person well can complete, can fill out. And anytime a person goes to a doctor's office, an emergency room, even if they're moving, say, from one service provider to another or one location to another, or there's a new person who's going to be helping provide support to that person, this information can be extremely valuable. So the types of questions that are on the other part of the My Health Passport, besides the medical things, are things like, when I experience pain, I often do what? How do I show people that I am in pain? Maybe I curl up in a ball. Maybe I hit my head on the wall. Maybe I bite my arm. So helping describe to other people how this person might show pain can really, make an impact on identifying that, well, this person's in pain. We need to do something about this. Other questions include things like, what's the person's usual level of mobility? Do they walk? How do they walk? Do they use a cane? Do they need a wheelchair? Those things are all really important to know what the person's baseline is, so that it helps very much in determining if there's a change in baseline. The person's diet information is on there, but not just the diet, but what type of assistance might they need when eating? Do they need someone to, help them with their plate, with their meals, or does that person eat independently? Same thing with drinking. There's information about height and weight, mainly weight, because weight is a very important measure of overall health and wellness. And not just the person's weight at the time, but there's a place to put what's the weight been over the past 6 months? What's the trend been, so that you can identify if there's been significant weight loss, or maybe at least what the person's baseline weight is. There's information about bowel movements. If you've worked in this field, the importance of making sure that people have regular bowel movements. And I'm sure you've seen a lot of the problems that can occur when a person gets very constipated. So the form has a place to put information about the person's regular bowel habits, and also any type of support that they need. Other social information, simply things like the things a person likes, and when they like it, how do they express that they like it? The things that a person dislikes, and how do they express something when they dislike it? The best way the person communicates, or do they need any type of assistive device or anything like that? And how do they express other things like anger or frustration or joy or happiness? So you can see that using a document like this and providing this to a person, let's say they get admitted to the hospital, and they all of a sudden have a different group of people who are providing support, and they don't know anything about that person. And the person, let's say, maybe is banging their head, and they say, well, they're banging their ear, so let me check their ear. Well, their ear is fine, there's nothing wrong, so maybe he just does this. When actually, that because of this document, they can look and see that anytime the person is in pain in any part of their body, they bang their ear. That's what they do for any type of pain. Then they may say, well, I think I need to look a little bit harder. So that's just a brief example of how this form can be helpful. There are a number of different types of health passports out there. We've developed one at IntellectAbility that's free for anyone to use. You can find it at replacingrisk.com, and it's on our COVID-19 webpage, or you can search for My Health Passport. Hope that you find this useful and helpful, and thank you for joining us today.
Hey everybody, thanks for checking out this episode of Medical Mondays with Dr. Craig Escude. We'll be back next week with a brand new episode and a brand new topic. So make sure to go down below and hit that subscribe button. We're also working on some new episodes for you guys, as well as putting out the podcast every week. So thank you all for watching, and we will see you next time.